I was there when Governor Shumlin gave his pretty remarkable State of the State speech in January 2014, where he devoted his entire speech to the opioid epidemic. And yet somehow I went from that moment without really understanding that the governor was talking to me, that the mayor's job in Burlington was one of the key seats in the state for doing something about this. There really wasn't anyone in charge of it. A whole host of organizations have had to change the way in which they do their own work and in which they relate to others. CommunityStat provided the venue for us to figure out those key changes. It's been the most hopeful and rewarding work that I've experienced in my time in government. We didn't know if it was going to work at first, and it really feels like it has. I'm not sure there's any other community in the country that saw a 50% reduction in 2018, but there are other areas where there have been a reduction in deaths and signs of improvement, and those seem to track with the places that have been proactive and that have, focused on medically assisted treatment. I do think there's enough data now, enough evidence that what we are doing here is working, that others should be looking to this and looking to scale up the interventions that we've had here. I'm hopeful that after years of work and after major community effort that has involved certainly the City of Burlington as well as the University of Vermont Medical Center and literally dozens of other community partners, that we have put forth a robust constellation of interventions. As a result, that the numbers that we saw in 2018, which seemed to indicate that we had turned this epidemic around and we're headed in the right direction, the terrible fever of this crisis, at least in Burlington and Chittenden County, is starting to break.